All right. Good morning, guys. The only reminders I have for you today are not really reminders, but just reminders that you can always come by my office if you would like to look at your exams. I had quite a few people emailing me, asking me what they got wrong in their exams and stuff like that. If you want to know that, come by my office. I'm happy to show you the key and everything you got wrong. We can talk about it, but I'm not going to email it to you. Okay, so just come by my office. You can schedule an appointment. There's a link to my scheduling calendar in the signature of all of the emails I've ever sent you. It's at the bottom. It says like book time with Juliana Kimmage. Just click on that. It'll take you to my calendar and you can make an appointment, or you can just come by during any of my office hours. Another reminder, this isn't happening today, but there will be a little bit of catch up to be played over the Mardi Gras break. So this Friday, depending on where we end, I have to see where we end on Friday before I post the recorded lectures. So I will post recorded lectures this Friday that need to be watched before we come back from Mardi Gras, so before the next Friday. So you'll have an entire week to watch them. I know it's supposed to be your vacation. I'm sorry, but there's nothing due. It's just you got to watch the recorded lecture to be caught up. And then that should bring us right back to where we need to be after we lost the week of the snowstorm. So this is the best way I could figure out how to not make it too crazy overwhelming and not have you have a test the day we got back. Yeah, so hopefully that is okay. And I'll remind you again on Friday, and I'll send out an email when I post them, but I'm just gonna say it a bunch of times so nobody can say that I didn't tell you. All right, does anybody have any questions about anything? As of right now, if I haven't said it out loud, I think that I have, but as of right now, exam number 4 is going to be on its normally scheduled day. It is not going to be pushed back, because if we push it back, then we're going into people who were planning on being gone already. You know, they followed the schedule and they had planned vacations and stuff. We're pushing stuff back. I don't want to do that. So as of right now, the exam number 4 is on the regularly scheduled day that it was in the syllabus. Don't remember the exact day at this exact moment. March 3rd-ish. I don't know, don't quote me on that. But it's on the exact same day that it was going to be on. It is not being pushed back or extended. All right? Any questions before we get started? Okay. Sorry. Those are the gross pictures. Okay, so where we left off last time, we were talking about infections of the skin and eyes, and we got through all of the bacterial and viral infections of the skin. Now we're going to talk about the fungal infections of the skin. And we don't have too terribly many, just a couple, but these are all fungal infections. They're caused by either molds or yeasts, funguses, fungal. Okay, and our first one is called tinea versicolor. And tinea versicolor is caused by a group of organisms. All you have to remember is Malassezia species. So you don't have to remember the species names. You only have to remember the genus name. So the genus name is Malassezia. And Malassezia is a very superficial infection, which means that it only really occurs on the very surface levels of the skin. It doesn't typically penetrate into the deeper layers of the skin. It's not really capable of that. And so most of the symptoms, the only symptoms I know of tinea versicolor are discolored patches of skin. It doesn't even cause redness or anything like that. It doesn't typically cause itchiness. It's just discolored patches. And these are 2 pictures of the discolored patches. This kind of top one is on a darker skin tone, a darker brown, and this one is on a more white pink skin tone. So it looks different on different skin tones. People with darker skin, the patches tend to be lighter. People with lighter skin, the patches tend to be darker. But it's just discolored patches of skin. There's not really any itchiness or redness or anything like that. Okay, and most of the time, Malassezia or tinea versicolor infections are transmitted endogenously from the normal flora. So these are just people that have it as part of their normal flora. And at some point in their life, they have some kind of change to their normal flora on their skin, and that can be from internal problems due to stress or hormone changes, menstrual cycle changes, life changes, diet changes. It could also be external things like swimming in pools with a lot of chlorine, or wearing different types of clothes, or different laundry detergents, right? There's lots of different things, environmental factors that can change your immune system. So Malassezia is mostly hanging out on most people's normal flora. And then if you have some kind of change to your other normal flora, this can pop up. And it's just changes to your skin tone, and that's it. Okay, and the treatment for it is, because it's not a very serious infection, it's usually just treated with topical antifungals. So just creams or sprays that go on the outside of your skin. And Malassezia, again, is not known for causing any deeper infections. It doesn't typically cause wounds. It doesn't become septic or anything like that. It mostly just stays on the surface level without any other symptoms. Okay, and then I think the only other fungal infection that we're talking about is actually a group of infections called ringworm. And ringworm, as a term, when we use it kind of in our everyday language, if you've heard of ringworm, you're probably thinking of this, right? If you've ever had ringworm, a lot of people have it as kids. But usually when we use the word ringworm as normal people, we're thinking of this infection right here, where you have this little circular patch of itchy fungal infections. But actually, ringworm is a collective term for any kind of fungal infection of the skin that kind of causes these similar symptoms. So things that we know as like, this is athlete's foot. You might know this as jock itch, right? There has lots of different names. All of those things collectively are known as ringworm. Okay? They are superficial skin infections. The symptoms of them, they go a little bit deeper than the Malassezia, and the symptoms of them are usually redness, itchiness, raised skin, itchy flakiness. If you've ever had athlete's foot or ringworm, you know how bad it itches. These are very common fungal infections. And the only thing that you have to know about the causative organisms is that they are caused by a group of organisms called dermatophyte funguses. And this one should be hopefully easy to remember, because derma, that prefix derma, is like a dermatologist, means of the skin. So a dermatologist is a doctor of the skin. A dermatophyte fungus is a fungus that affects the skin. Okay, so it's just a group of funguses that all affect the skin, and they kind of cause these different types of skin fungal infections. And it can be of the nails as well, and any part of the skin. They are transmitted through direct and indirect contact. And like we kind of covered last time, these are most common in adolescents, because adolescents are not as hygienic, and they tend to not have as many personal boundaries as, older people. Adolescents and kids in school and things like that don't have, they just don't have as many boundaries. They don't have as many problems just touching everybody and everybody, sneezing in your hand and then rubbing it on somebody else, right? Kids are gross. And so adolescents tend to be the ones who get this kind of thing the most. Though not always. It's entirely possible to get athlete's foot from using a shower at the gym or anything like that if you don't wear shower shoes. And the treatment for these are topical antifungals. So you can buy the treatments for these at Walmart, right? There's like jock itch spray and cream. There's nail polish and creams that you can put for nail funguses, sprays and creams. You can buy them over the counter. So dermatophyte funguses and funguses of the skin are typically, again, not very serious infections. They're not known for causing internal infections. Most funguses are actually not all that great at growing inside of a human body. It's too warm and there's not enough light. So they don't grow very well in there. But on the skin, they grow pretty well, but they don't cause much problems outside of some itchiness and discomfort and some discoloration that you might find embarrassing and frustrating, but it's not gonna invade your body and cause a more serious infection. Okay. All right, so now we're done with the skin. So we're gonna move briefly to the eyes. And this is the part, and I get it, a lot of people are really freaked out by the eyeballs. So I apologize for the pictures. They are a little gross. A lot of people are really weirded out by eyeballs, especially diseased eyeballs. But a quick anatomy of the eye. Now, you don't have to remember all of this stuff. The biggest parts that I want to talk about are the sclera of your eye, and the sclera is the white part. So if you're looking at your eyeball, your sclera is the white part of your eye. It's like the tissue of your eye. The white part is the tissue. And the conjunctiva is a membrane. It's a very, very thin membrane that covers the sclera. Okay. And if you don't know, the pupil of your eye is actually a hole in the sclera. So you can see here, the black part of your eye, the pupil, you can kind of see it right there, is a hole in the tissue. Okay, so there's not tissue in the pupil. That's where all the light gets in. There's a hole in the tissue of your eye, and that's your pupil. And then the cornea is a little, for lack of a better term, it's a little cap that covers the pupil. So your pupil, again, is a hole in your eyeball. And so to prevent things from getting into your eyeball, you have this little cap. It's like a little cover or a lid that is called your cornea. And that's why if you look at somebody from the side, and this, I know it's weird, but everybody's eyeballs stick out a little bit from the surface. There's like a clear part that sticks out. And you guys are all looking at each other trying to see it. There's a little clear part that sticks out just a little bit further than the white parts of your eye, and that is your cornea. It's a little cap that covers the hole in your eyeball. Okay? That's all we got to know about the anatomy. All right, so our first infection is our most common infection of the eyes, and it's called conjunctivitis. Now, based on our words that we know of, remember, what does itis mean? Inflammation. So if you had to guess, what do you think this is inflammation of? Conjunctiva. The conjunctiva. So conjunctivitis is inflammation of the conjunctiva, which, remember again, is the surface outer membrane of your eye. So this is infection or inflammation of the conjunctiva, which is the outer membrane of the eye. Okay, so this doesn't, conjunctivitis, when it's conjunctivitis, doesn't penetrate to the deeper layers of the eye. It's a surface level infection. Okay. Okay, because it's an infection of that outer membrane of the eye. And these are the two organisms that, again, I have chosen for you to have to remember for this. There are lots of different organisms that can cause conjunctivitis. These are the two that I've picked for you to have to know. And they are Haemophilus influenza and Moraxella catarrhalis. Okay, those are the two organisms, two bacteria. I guess I should say that. Those are the two bacteria that cause conjunctivitis. And there are also many, many viruses that also cause conjunctivitis. You're not going to have to remember the names. Just know that viruses can also cause conjunctivitis. Now, does anybody know what this is commonly known as? Pink eye. This is more commonly known as pink eye. And you've probably heard of this before. And it is called that because it makes the surface of the eye red or pink. Makes the eyeballs appear pink eye. So it can be caused by bacteria, specifically Haemophilus influenza or Moraxella catarrhalis, but it can also be caused by many different types of viruses. Many cold viruses and flu viruses and things like that also cause pink eye. And the most kind of hallmark symptom of pink eye, the fancy word for it is a mucopurulent discharge. That's a really hard word to say, it's purulent. But purulent is just a fancy way of saying it has pus. So a purulent infection or a purulent wound is one that produces pus. So the hallmark symptom of pink eye or conjunctivitis is the production of this mucousy and pussy discharge that comes out of the eyeballs. Okay, and these are pictures of them. You can see sometimes they look really crusty. The eye on the outside can appear really swollen. If you've ever had pink eye, you know what it feels like to wake up and have your eye crusted shut because the discharge is coming out and dried overnight. But that's kind of the big symptom of pink eye, is the redness and the mucopurulent discharge. And the transmission is direct and indirect contact. Again, either touching, I don't know why you'd be touching eyeballs with somebody, but it's mostly through indirect contact, rubbing your fingers in your eyes and then touching somebody else's face. I mean, I guess you could touch eyeballs if you really wanted to, but direct or indirect contact, you can get pink eye from sharing makeup with somebody, you can get pink eye from sharing a pillow with somebody, you can get pink eye from touching your face and then touching somebody else, or touching your face and then touching their hand and then they touch their face, right? So direct or indirect contact. Again, most common in children, because in children, it's really hard to get them to not touch their faces when it's uncomfortable, right? As adults, we kind of have a more, like if I had pink eye, I could tell myself, like, don't touch my eyes, and then don't touch anybody else, and sanitize my hands all the time. But kids, it's really hard to get them to not touch their eyeballs when they're itchy and uncomfortable. Okay. And treatment of this, typically conjunctivitis, again, is not a very serious infection. It's what we call a surface level or a superficial infection. It infects the outer layers. And sometimes you will get antibiotic eye drops. You get antibiotic eye drops if, and only if, it is bacterial conjunctivitis. If you have bacterial conjunctivitis caused by a bacteria, then you will be given antibiotic eye drops, because antibiotics are for bacteria only. If you have viral conjunctivitis, you will be given nothing. And the treatment for it is just putting warm water on it and keeping it clean and waiting till your body fights it off in a couple of days. Okay? But that's a big thing there, is just because, like, if you have kids now, or if you ever have kids in the future, or you yourself get conjunctivitis, it's always important to remember that you don't always need antibiotics. A lot of times, pink eye will go away on its own in just a couple days if you keep it clean and you don't spread it. You don't always need antibiotics. It's always a good idea to see a doctor. They'll be able to do tests and figure out if it's bacterial or viral, or give their opinion if it's bacterial or viral. But you don't always need antibiotics for pink eye. Depends on what causes it. Okay, so that's conjunctivitis. Again, remember, it's a surface level infection of the conjunctiva. Okay. Now, this is a very special type of conjunctivitis, and it's called neonatal conjunctivitis. Neonatal means basically newborn. Oop, that's not how you spell that. Sorry. Newborn or young infant. I don't really know what the cutoff is, but it's usually, we're not gonna have to know that here, but it's typically just a newborn / young infant. Shortly after birth is what we refer to as neonatal. Like the neonatal intensive care unit, the NICU, is for newborn babies. Okay? Now, the two causative organisms of specifically neonatal conjunctivitis are these two organisms here. And I want you to look at those words. I'm not going to say them out loud, but you should be able to figure it out. What infection do you think this organism causes? Chlamydia. It's called Chlamydia trachomatis. So the infection this causes is chlamydia. And what about the second one? Gonorrhea. Okay, so these are both organisms that cause sexually transmitted infections. We haven't gotten to the STIs yet. It's always a fun time, but we haven't gotten there yet. But these two are very commonly known for causing sexually transmitted infections. which means that they infect the genital tract. And so if the person giving birth has either chlamydia or gonorrhea active chlamydia or gonorrhea at the time of birth, as the baby is passing through the vaginal canal, that bacteria can get into their eyes and cause infection. Okay? And the signs and symptoms of initial conjunctivitis are a mucopurulent discharge in specifically a newborn. The transmission/prevention of this is it's passed vertically during birth. So remember, vertically is when you pass something from parent to offspring. Horizontally is within a single generation. We talked about this in terms of DNA transfer, but it also works with infection transfer. So horizontally is within the same generation. Vertically is during birth. So specifically, this type of conjunctivitis is passed from birthing person to infant during birth as the baby passes through the vaginal canal. And the prevention of this is pregnant people are typically screened. Again, I don't know how many of you have ever been pregnant before, but if you go to a traditional doctor, working in a traditional doctor's office, things are different in places like midwife care and stuff like that, but a traditional OBGYN doctor's office, you're gonna get screened for chlamydia and gonorrhea at least 3 times during your pregnancy. Doesn't matter if you tell them that you've never had sex with anybody but the person that impregnated you, doesn't matter. They basically don't care. You get screened for these things multiple times during pregnancy. And the big reason for that is because both of these things, regular conjunctivitis, if you catch it as a kid or an adult, doesn't matter. You have an itchy, weird-looking eye for a couple of days, and then you get better. It's typically fine, not a big deal. Neonatal conjunctivitis, on the other hand, has very, very serious consequences if it's not treated. Chlamydia trachomatis, and a lot of people don't know this, so chlamydia trachomatis is the leading cause of only infectious is the leading cause of infectious blindness across the world. So chlamydia trachomatis, if it infects the eye of anybody, but specifically newborns, you can get chlamydia in your eyes. Okay, I'll let you use your imagination how that could happen as an adult. But you can absolutely get chlamydia in your eyes. You can get gonorrhea in your eyes too. You can also get all of those in your joints. You can get gonorrhea arthritis. We're gonna get to that later. But specifically in newborns, chlamydia trachomatis causes this really horrific thing to happen. One of the major symptoms of chlamydia trachomatis eye infections, and I'm not writing this down so you don't specifically have to remember this, but it causes your eyelid to flip inside out. And what happens is if you don't have surgery to remove the eyelid, the eyelashes scratch the cornea over and over and over and over every time you blink until your cornea doesn't work and you eventually go blind. So chlamydia trachomatis infections are very serious. They have very serious ramifications. Gonorrhea infections can cause loss of the eye if they are not treated quickly enough. So that is why these 2 infections in particular are taken so seriously, and why, as a pregnant person, you may or may not be tested for these multiple times, and why people taking care of pregnant people take it so seriously, because these types of infections can have lifelong consequences for a newborn that had no choice in the matter, right? So again, specifically, these 2 sexually transmitted infections are specific to neonatal conjunctivitis. All right, and so this is probably the grossest picture I have, but the last infection I think the last one, no, maybe not. Yeah, the last infection we're gonna talk about in the eye is something called keratitis. And keratitis, it's not specifically in the name, but keratitis is inflammation or infection of the sclera and other tissues of the eye. So again, conjunctivitis is an infection of that outer membrane, not the actual tissue of the eye. Keratitis is when the infection gets into the tissues of the eye. It can be infection of the cornea, it can be infection of the iris, or infection of the sclera in specific. So this is when the actual tissue part of the eyeball is infected. So this is a much deeper infection. It's also a much more serious infection. And the most common causative organisms are Pseudomonas aeruginosa, and this is a bacteria. And Pseudomonas aeruginosa is a bacteria that's known for its normal environment. Its very normal reservoir where you find it is in the water. Okay, so it usually typically grows in the water. It's very capable of growing, Pseudomonas is a pretty nasty bacteria. It's very capable of growing in hot water. It's also very capable of growing in salt water. So a lot of bacteria can't grow in salt water. Pseudomonas can. It can also grow in hot tubs and things like that. Herpes simplex virus, which causes, so that's a virus, obviously. This is also the virus that causes herpes and cold sores, or oral herpes. And then acanthamoeba is an amoeba. Okay, so it's a little amoeba that has that foot-like motion. It has the pseudopodia, and it's also in water sources. So it's a little amoeba that can infect the eye. And the signs and symptoms of this are extreme pain, swelling, cloudiness of the eye, discharge, all kinds of things. And this can actually lead to blindness and loss of the eye as well. Okay. These are very serious infections. They go much deeper into the tissue of the eye. And when it goes into the tissue of the eye, you have a much higher chance of that tissue becoming permanently damaged or having to be removed so it doesn't spread to the rest of your body. Okay, so keratitis is an extremely serious infection. It needs to be treated seriously. Transmission of this is through direct contact. So that means that you come in contact with somebody else that has it, or you come in contact with one of these organisms in their natural reservoir, which means you get Pseudomonas infected water in your eyeball, you get acanthamoeba infected water into your eyeball. But by far, the most common way that people get keratitis is through improper contact lens use. So the next time, if you do this, and I know that some people say it's okay, but I want you to look at these pictures and decide if it's worth it. The next time you sleep in your contacts for multiple days, or you don't change out your saline, or you don't take care of your contacts properly. By far, the most common way that keratitis happens is through improper contact lens use. If you don't have contacts that are dailies or whatever else, and you don't take them out every night and put them in saline to be cleaned, or if you don't change, another way that it can happen is, if you're a contact lens user, you know this, but with every bottle of saline that you buy, you get a new contact lens case. If you don't use the new one, if you keep using that old contact lens case, it can develop Pseudomonas, and it can form on the contact lenses. Pseudomonas is also an infection, a bacteria, that's particularly good at forming biofilms. So what that means is it forms those really hard to kill biofilms on your contact lenses or on your contact lens case, which can expose you to the bacteria. Okay, so again, I mean, if you're using your contacts properly, there's not really any risk of it, but the most common way this happens is through improper contact lens use. Or like, I don't know, I wore contacts for a long time, and then I hit 35 and I was over it and didn't care anymore. And the idea that you could lose a contact in your eyeball and not be aware of it is baffling to me. But apparently there are some people that like, they'll lose a contact or they'll forget that they're wearing them and the contact will go like up into their eye and just sit there and they forget about it. I don't know how that doesn't hurt, but apparently that can happen. So keep track of your contacts if you wear them. But yeah, it can also happen due to trauma to the eye, if you're in some kind of accident or you get punched. I don't know why you get punched, but some kind of accident or something like that where your face and your eye have some kind of trauma to them, that can also introduce organisms to the eye, and that can cause keratitis as well. Treatment for keratitis is antibiotics, sometimes IV antibiotics, and possibly surgery to remove the infected tissue, depending on how serious the infection is. So when I was in the hospital after my car accident, so I was airlifted to LSU Shreveport. I don't know if you guys know this, but LSU Shreveport is completely overrun. And so nobody gets a room to themselves. Everybody has to share. And my roommate for a lot of this was like an 85-year-old woman who had the most gnarly eye infection I've ever seen in my life. She looked like she had a softball stuck on her eye, and she had keratitis. So her eye was super swollen so that she had to have like 3 different surgeries to drain it and remove all the infected tissue. She didn't lose her eye as far as I know, but it can be pretty traumatic. She was really scary to look at. I was very scared of her. All right, so our last, this is the last slide for this, and this is just a summary of these 2 systems of skin and eyes, of the bacteria and the types of infections. Always remember, like some of these, we don't always talk about absolutely everything on here. So like, for example, we didn't talk about parvovirus. So if we didn't talk about it, you don't have to know it. But this is just, for the most part, a pretty good overview of the different types of infections we talked about in this chapter. Okay. Again, if we didn't talk about it, then you don't have to know it. Like we didn't talk about like trichophidin or any of this, so you don't have to know those, okay? But I included it because I thought it was a good thing. All right, so now we're moving on to our next chapter, chapter 17. And chapter 17 is our infectious diseases affecting the nervous system. And this probably has some of the gnarliest infections, at least I think so. The ones that are the scariest. Anything that has to do with like your brain and your nervous system is always really upsetting because they have full body consequences, and they can be incredibly deadly. So this is chapter 17, and again, a little bit of anatomy, and I'm gonna point out the things that you have to know about this. So your nervous system is broken up into 2 parts. You have a central nervous system, which is also known as the CNS, the central nervous system. And your central nervous system is called your central nervous system because it's in the center of your body. So this includes your brain and spinal cord. All the stuff that goes straight down the center. Your brain, your spine, and your spinal cord are all part of your central nervous system. And then in the rest of your body, you have your peripheral nervous system, or your PNS, which is all the nerves in the rest of your body. And your nervous system controls a lot of different things. It controls every part of everything that your body does. But a big, huge part of what it does, and what we're going to kind of focus on a lot here, is the nervous system controls all of your thoughts and feelings, and it also controls all of your movement. So your nervous system makes you move. It controls the contraction and relaxation of your muscles, both voluntary and involuntary, right? Breathing is not a voluntary thing. Your brain just does it, right? The contracting of your heart is not a choice that you make. It's something that your body just does. But all of those things are controlled by your nervous system. Your heart, kind of not, but that doesn't matter. That's all controlled by your nervous system. And so your peripheral nervous system is everything that spreads out into the rest of your body, specifically your arms and your legs and all of your organs and all of that stuff. Everything outside the brain and spinal cord. Now, the big part that we need to remember here, why don't I see? Okay. All right, it's not labeled here. That's okay. So the big thing about this is inside your brain, you have your brain, obviously. Inside your skull, you have your brain, which is the control center of your nervous system. It's what controls your entire body. Surrounding your brain, you have something called the meninges. And the meninges are a membrane that goes all the way around your entire nervous system, your central nervous system. And your meninges, a big part of what they do is they are a fluid-filled membrane, which means that your brain has water around it, it has fluid around it, and then the meninges hold in all that fluid. And the big part of why you have meninges is because, right, your skull is really hard, your brain is very squishy, and when you go like this, you don't want your brain to whack against the side of your skull. So that's a big part of why you have meninges. It's to cushion that movement, right? Because you're going to move your body. And every time you move your body, you don't want your brain whacking against the sides of everything. It's like putting a ball inside of a box. Every time you move the box, it's going to whack around. And you don't want that to happen. So your meninges hold a bunch of fluid, which cushions your brain inside of your skull. Okay? That's what a concussion is, if you don't know that. A concussion is when you hit your head so hard that your brain manages to hit the side of your skull anyway and causes a bruise on your brain. That's what a concussion is. So we're going to talk a lot about the meninges, but the meninges are the membrane. It's not technically part of your brain. It's the membrane surrounding your brain. I think that's all you need to know. Oh, the other thing that I wanted you to know is something called the blood-brain barrier. So the inside of your central nervous system, so inside the meninges and the fluid inside of the meninges and your brain is incredibly restricted to the rest of your body. So around your brain, there's not blood. It's this fluid that most things can't get into. And the reason for that is because your central nervous system is the central part of your body. It controls every part of your body. So if something is going wrong in the rest of your body, your brain is going to do everything that it can to protect itself. And so what the blood-brain barrier is just a barrier between the blood and the central nervous system. Very few things can get into the central nervous system. Blood cells can't get in there. Very few white blood cells can get in there, even for immune function. A lot of drugs can't get in there. Lots of things cannot cross that blood-brain barrier. And the reason for that is to keep your brain safe. So the inside of the central nervous system and the peripheral nervous system, all of these systems are completely sterile, as far as we know at this moment. There is no bacteria, no viruses, no funguses that normally grow inside your nervous system. There should not be any microorganisms in there. The inside of your brain should be completely sterile. There's no known normal flora inside the nervous system. Okay? And again, that's to protect your brain. We don't want bacteria in there, we don't want viruses in there, we don't want funguses in there. Your body is going to protect your brain at all costs. So the blood-brain barrier is how it separates the rest of your body from your central nervous system. Oh, okay, no. So meningitis is our kind of biggest infection inside of this category. Meningitis, as you can probably guess, is itis, inflammation of the meninges. It's inflammation of the meninges. Inflammation or infection. So this is an infection within the central nervous system. The actual membrane surrounding the brain and the fluids surrounding the brain are infected with either bacteria or viruses. And I think we talk about a couple of different types of things. But as a general category, meningitis is just an infection or inflammation of the meninges. The transmission of meningitis is in adults, and we're going to talk specifically about neonatal and babies in a little while, but in adults, most transmission of meningitis is through the respiratory tract. So this is a weird thing to think about inside of our own bodies, but your respiratory tract is your nose and your mouth and your trachea, right? You breathe in and it goes into your lungs. So your respiratory tract goes down the front of your neck, right? You breathe in, your trachea goes down the front of your neck into your lungs. Okay, your spinal cord goes right down the back. Okay, your brain is up here and your spinal cord goes down the back of your neck. So in your neck and mouth, your respiratory tract is incredibly close in proximity, physical space, to your meninges and your central nervous system. They come in very, very close contact. So things inside of the respiratory tract can and do migrate to the central nervous system because they come in close contact with each other. So again, in adults, most cases of meningitis, not all of them, but most cases of meningitis are spread through the respiratory tract. So you get a respiratory infection first that can then spread into the meninges in the central nervous system. The signs and symptoms, the initial signs and symptoms that can indicate meningitis, and I always kind of go into this a lot because this is one of those things that meningitis, we're going to talk about this more in just a minute, but meningitis is particularly, certain types of meningitis can be spread through college-aged people pretty quickly. And it doesn't happen very often, it's not super common, but it's the kind of thing that if it does happen, it's incredibly deadly, incredibly quickly. And so we talk about these signs and symptoms because, not that I want you all to be worried about, but if you ever come across somebody that has these very specific symptoms, I want it to trigger something in your brain so that you know to make them go get help. Because it's not the kind of thing that you want to put off. Okay, so the big signs and symptoms are an incredibly high fever, bleeding under the skin, which is also called petechiae, and that will look like little tiny bruises. So lots and lots of little tiny bruises, a lot of times especially on the legs, but it's bruising underneath the skin. That's kind of a later symptom, but we put it there anyway. A big one is delirium. So if your friend has a fever, or you have a fever, and they're acting like they're drunk, or they just can't figure it out, they're walking funny, like their brain is not connected to the rest of their body and connected to their words, that can be a symptom of meningitis. A really awful headache can also be a symptom. Now, fever and headache is a symptom of the flu too. But the big one that can kind of separate, or two big ones, I don't think I have one of them written down. The big things that can separate this from something, or this from something not as dangerous, are light sensitivity. But again, light sensitivity, anybody who's ever had a migraine knows that you have light sensitivity with a migraine. So having a really awful migraine will come with light sensitivity. The kind of big test that I always try to tell people to keep in mind is neck stiffness. So if you have a friend who has a fever and they're complaining of a headache and you're gonna feel dumb, but it's something that could save somebody's life, is the neck stiffness. So if your friend can't touch their chin to their chest because the meninges are swollen, so remember your spine is right back here. So if you have inflammation of your meninges and your spinal cord, you won't be able to touch your chin to your chest, or it'll hurt really bad, right? That shouldn't hurt like that. So that's kind of the big symptom of possible meningitis. Not to say that if this happens to everybody, you have meningitis, but these are things to keep in mind if you ever know somebody who, again, has a high fever, they can't touch their chin to their chest, they're acting weird, they're acting drunk, they can't walk straight, they're delirious, their brain is not communicating with the rest of their body. It's always a good idea to go to the emergency room to have them checked. Because again, this is not the kind of thing that you want to mess with. It can get really serious incredibly quickly. And meningitis is the type of thing where literally 30 minutes can make a difference between life and death. So it's not the kind of thing like, oh, well, they have all these things, but we'll wait until tomorrow and see if they feel better. Don't wait. Okay? The neck stiffness thing is a big one. And I don't mean this to scare everybody. It's not something that happens very commonly, but if you can help somebody when they're going through this, all the better. Okay, so then the later symptoms, those are kind of the early signs and symptoms that happen in the initial stages of the infection. Later, what happens is something called shock. And what shock is a dangerous decrease or drop in blood pressure. So we're going to talk more about shock when we get to sepsis, but it basically just means that your body is not getting enough blood. Your blood is not pumping fast enough or hard enough, and your organs are not getting the blood that they need to survive. And so shock will eventually lead to organ failure, which can lead to cardiac failure. Cardiac failure is heart failure. And something called intravascular coagulation, which is a fancy way of saying you form blood clots inside your body. So all your blood, you want it to be a liquid when it's inside you. And intravascular coagulation means that it's coagulating or clumping or clotting inside your blood vessels. Okay, so an intravascular coagulation, heart failure, and organ failure can all very quickly lead to death. And if not death, it can lead to permanent damage, permanent brain damage. So that's why I mention it, and kind of it's something to keep in mind and take seriously. Is because it, like I said, meningitis, 30 minutes can be the difference between permanent brain damage and being perfectly fine. So it's not something to put off. Okay. So that's meningitis in general. Now we're going to talk about kind of specific types of meningitis. Bacterial meningitis is caused specifically by 3 different organisms, or the 3 that we're going to talk about here. The first one is called, and this one's the easy one, it's Neisseria meningitidis. It has meningitis in its name because it's specifically known for causing meningitis. And Neisseria meningitidis is also known for causing something called meningococcal meningitis. So if you ever hear that term, they use that in like those weird commercials for vaccines and stuff that you see all the time. They'll talk about the meningococcal vaccine or meningococcal meningitis. They're talking about meningitis caused by Neisseria meningitidis, meningococcal. And it is spread through direct contact. This is the one that we talked about. The highest risk is usually adolescent or teenage, young adult, children. I mean, 20 people who are 20 years old aren't children anymore, but between 10 and 20 years old, kind of that preteen to teenage, early adulthood, young adult age, 10 to 20. And this is the one that we talked about. Neisseria meningitidis is a bacteria that is normal flora in the respiratory tract. And it is the most common in that age group because that is about the time that people start coming in closer contact with other people's respiratory secretions. Okay, that's the time that people start exploring things physically, they start kissing other people, things like that, right? So about, 13, 14, 15, I don't know how people are, but that's about how old people are. But that's about the time that people start getting closer to people that they have never been around before, right? So like you have lived around your family your entire life. You've probably shared cups with your brothers and sisters. But around that age is when you start exchanging fluids with people who don't live with you, people you have never been around before, okay? And so this can be contracted, and it's most commonly contracted and transmitted through direct contact, mostly through kissing or some kind of sexual activity where you're exchanging respiratory secretions directly from one person to another. This is not typically transmitted through like indirect contact, like sharing sodas or anything like that. It's usually direct contact. But the highest risk for Neisseria meningitidis is in this kind of 10 to 20 age group. Not to say that anybody else outside of that range can't get it. That's just when it's most common for them. Okay. Our second one is called Streptococcus pneumoniae. This is another bacteria. Remember, all of these are bacteria. And this causes pneumococcal meningitis because the species name is pneumoniae, so it's pneumococcal. And it's this is the most prevalent. So most cases of meningitis are caused by Streptococcus pneumonia. And it is most common in the elderly. So the elderly are most at risk for this because that's about the time that your immune system starts to kind of give out on you. As you age, your immune system is not as fast, it doesn't work as well. And so as people get older, they get infections more easily. And so all of us are exposed to Streptococcus pneumonia all the time. It causes lots of other types of infections that we'll talk about later. But as people age, they become more at risk for getting meningitis from this bacteria, of it being able to cross into their central nervous system and cause infection. And there's also a vaccine available for this. This is one that they start recommending that you get, I don't know the age, maybe 50, 45, 50. I haven't had to have mine yet. But there's a vaccine that they recommend you get as you age. Okay, and then Haemophilus influenza is our third bacteria that can cause bacterial meningitis. And the only thing you really have to know about this one is that the highest risk age group are children less than the age of 5. Okay, and then these are the symptoms we had here. This is all the stuff we had on the last page, but the fever, headache, the stiff neck, the really sore, stiff neck, the photophobia, or the sensitivity to light, nausea and vomiting is another one, and then a confused or altered mental state is another big symptom. And this right here is what petechiae can look like as it gets further along. So this is what that intravascular coagulation looks like when it gets to its more serious stages, because the clots inside of your vascular system cause blockages that block flow to tissues, to organs, to the skin, and as the blood flow is cut off, the tissue dies. So that's what's happening here, that the blood flow is being cut off to the tissue of the legs and the feet, and it's causing the tissue to die. So a lot of times if meningitis goes on too long, it can result in amputation. So sometimes the only way, because once the tissue dies, there's no reviving it, and all that's gonna happen is that tissue is going to necrose. It's going to disintegrate. Okay, so a lot of times with people, even people who survive meningitis, amputation is a very real side effect or very real consequence. Meningitis can also cause permanent brain damage, all these things. And it can cause, like I said, death very, very quickly. Right? Okay, so we are going to talk about, now keep in mind these bacterial meningitis and these meningitises, I don't know the plural, meningitises are all in adults or people who are not newborns. We'll say that because we're going to talk in a minute about like neonatal and newborn meningitis. That's kind of a different situation. But these bacteria here and then these others we're all talking about in non-newborns. Okay, so there are other types of meningitis that can happen. This first one up here is fungal meningitis. So you can actually have, there's a yeast that is called Cryptococcus neoformans that causes fungal meningitis. It's a yeast that is able to get past the rest of your body and into your central nervous system. And Cryptococcus neoformans is only really associated with people who are severely immunocompromised. And when I mean severely immunocompromised, I mean they basically have no immune system. So one of the biggest associations of Cryptococcus neoformans is in people who have advanced stages of HIV. So I don't think we've talked about HIV much, HIV and AIDS. We've talked about them a little bit, and I think we're talking about them more when we get to the immune system, but infections of the immune system. But HIV basically is a virus that infects your immune system. And over the course of the virus, it systematically destroys your entire immune system. So when a person gets to the end of their life with HIV, when they've had it for decades, if it hasn't been treated or the treatment hasn't been successful, it leads to something called AIDS, which is acquired immunodeficiency syndrome. You don't have to write it down. We'll talk about it later. But it basically means you have no immune system left. Your T cells are all gone. You have no immune system. And so Cryptococcus neoformans is an infection that's associated with that level of immunocompromising, that you basically have no immune system left. So advanced stages of HIV and AIDS. It can also be seen in people who are undergoing chemotherapy, right? Chemotherapy for cancer trashes your immune system. A lot of them. They completely get rid of your immune system. So when I say immunocompromised here, I mean severely immunocompromised. I don't mean, you were kind of sick and run down last week, and so your immune system's not the best. I mean very, very severely immunocompromised. Because funguses and yeasts don't grow very well inside the central nervous system. The immune system kills them before they have a chance to grow. So really, this only happens, again, in severely immunocompromised patients. And then last, we have viral meningitis. We're not going to talk about specific viruses because viral meningitis can be caused by many, many common viruses. It can be caused by herpes viruses. It can be caused by flu viruses. It can be caused by coronaviruses. It can be caused by measles viruses, rubella viruses. All of these viruses are capable of infecting the meninges and causing meningitis. Any type of viral infection is capable of crossing into the central nervous system. However, typically, these are generally less severe than bacterial or viral meningitis, or bacterial or fungal, Viral meningitis tends to be the least severe. It tends to have the best survival rate, viral meningitis. But yeah, we're not going to talk about the individual viruses. It can just be caused by a lot of things, a lot of viruses. Okay, now specifically in non-newborns, or specifically in newborns, the last two that we talked about were non-newborns. This is specifically meningitis in newborns. Now, newborns are capable of getting all of those other types of meningitis that we talked about. It's not like newborns have this special protection against those things. But meningitis in newborns is usually caused by these two bacteria. Okay? So when you have meningitis in a newborn, it's most likely to be caused by these rather than those other ones. Okay? And the reason that these are associated with newborns, we're going to talk about for each of these. So this first one is called Streptococcus agalactiae. The bacteria is called Streptococcus agalactiae. This is also known as group B strep. So this is something that as you go, if you continue in nursing or healthcare or something like that, a lot of times they talk about this particular bacteria as group B, or you have to have a group B test, or your B strep test, or B something test. Because Streptococcus agalactiae, also known as group B streptococcus, right there, is normal flora in the vaginal tract in about 30% of the female population. Okay? And in an adult vaginal tract, it does absolutely nothing. If you have group B strep in your vaginal tract as normal flora, it doesn't affect you at all. It doesn't cause sexually transmitted infections. It doesn't cause infections at all, typically. It doesn't cause you any problems. Most people who have group B strep have no idea that they have it because it doesn't cause them any problems. There's no infection. You don't pass it on to a partner. It's not an infection. However, if that group B strep from the vaginal tract is introduced vertically during birth, specifically if that group B strep gets into the mouth and eyes of the baby being born, it can and does cause meningitis. Because again, it's being introduced to the respiratory tract where it is not normal. So it's taking this bacteria that's normal in the vagina and putting it somewhere where it's not normal, in a respiratory tract. And in a newborn with basically no immune system, it can and does lead to meningitis. And it's incredibly deadly. Most babies, I don't know, I don't have any percentages, so I don't want to say that, but a large percentage of newborns that get group B meningitis do die from it. It's an incredibly serious infection, which is why, and it has a simple cure or simple prevention, which is why people who are pregnant are screened during pregnancy. So if you're ever pregnant, or if you ever have a partner that's pregnant or whatever else, you get a really fun swab at about 30 weeks pregnant where they swab your vaginal tract and your anal opening, and they send it off to a microbiology lab, and a microbiologist will look at it and see if they see group B strep. And if they do, if you are positive for group B strep, all that happens is when you go into labor, they give you some antibiotics. That's it. And the antibiotics during labor prevent the transmission during birth. So it does have a relatively easy, which I know isn't fun. I imagine being hooked up to an IV and antibiotics while you're in labor is not a great time. But in general, most people think it's worth it. Now again, that is something that happens in traditional OBGYN doctor's offices. There are midwives and things like that that practice more of that they don't think that's necessary. I don't know the research on it. I'm just talking about what they do in traditional OBGYNs. Okay? So they'll test you at about 30 weeks pregnant, about 10 weeks before you give birth, and check to see if you have this bacteria. And if you do, you will be put on antibiotics while you're in labor and right before you give birth, and that typically prevents the transmission from mother to infant during birth. So it is passed vertically during birth. And again, remember 30% of the population, or approximately 30% of the population, is positive for this, and they have no problems at all. It doesn't cause any issues in a normal vaginal tract. Okay, and when I worked in the hospital, I worked at St. Francis, which was connected to the women's clinic in St. Francis, if you know that. And we used to get these all the time. I swear that the Group B tests were the scariest part of my job, because it was looking at all these plates and like examining them for this bacteria that could potentially kill their newborn, right? It's a terrifying part of my job, but it was something that I did all the time. And about 30% of them were positive, and it was my responsibility to report them as positive, and their caregivers took that information and made sure that they were taken care of properly. Okay, and the second one is something called Listeria monocytogenes. Now, Listeria monocytogenes is kind of a weird one. It is a food-borne pathogen. So it is a bacteria. We've talked about this one a little bit. It grows in refrigerated foods. So Listeria, unlike most human pathogens, it can survive and does very, very well inside of the refrigerator. So at refrigerated and sometimes even freezer temperatures, it can survive really well in the refrigerator. So food that you don't cook before you eat it has a high risk of being contaminated with Listeria. So things like prepackaged salads or salad greens, right? Anything that you eat raw out of the fridge. Cheese, it's also known for coming in like lunch meat is a big one. Soft cheeses, any type of prepackaged salad greens, anything that you eat uncooked out of the fridge. Listeria is capable of growing in those foods. Now, if you are not a pregnant person and you get Listeria, it gives you food poisoning. It gives you a mild food poisoning that's really uncomfortable for a couple of days, and then you get better and you're fine. However, if you get this while you are a pregnant person, it can be transferred through the placenta. So Listeria monocytogenes is one of the few bacteria that can cross the placenta. So the difference here is that Streptococcus agalactiae is passed vertically during birth. So typically, newborns or fetuses are not exposed to group B strep while inside the uterus, while in utero. they are exposed as they exit the uterus. Listeria monocytogenes, they are exposed while they are in utero. At any time during a pregnancy, if the pregnant person is exposed and contracts Listeria, that bacteria can and does cross the placenta. And it almost always, almost 100% of the time, causes fetal death and stillbirth or spontaneous abortion, depending on what time of the pregnancy it is. So that is why, if you don't know, this is why there are so many restrictions on pregnant people. A lot of those restrictions have to do with Listeria. I don't know if you guys know this, but if you're ever pregnant again or have a partner who's pregnant, you can't eat turkey sandwiches, but that's what they tell you. You can't eat anything like cold cuts. Cheese, they don't recommend. They don't recommend you eating sushi, because it can grow with sushi, especially pre-made, pre-packaged sushi. Stuff like that. So a lot of the recommendations on what not to eat during pregnancy come from the possible Listeria exposure. And just that the chances of contracting Listeria are incredibly, incredibly, incredibly low. The chance of that happening, super uncommon. Most of you have probably never been exposed to Listeria in your entire life. However, if you happen to contract it, again, a very tiny percentage, but if it does get contracted, the chance of fetal death is almost 100%. And so those are not great numbers, right? So, everything that you do in your entire life is going to be about risk assessment and deciding if the risk is worth the possible outcomes. That's just one of them. The risk of it, getting it, is incredibly, incredibly, incredibly low. But if you do contract it, the chances of fetal death are incredibly high. So it's just a risk and weight thing. And I understand, believe me, of course, the second I was pregnant and they told me that I couldn't have turkey sandwiches, that was all I wanted to eat for 10 months. And it was the first thing I had to eat after I gave birth. I made my husband go to Jimmy John's the minute I gave birth. But those are the things you give up, I guess, turkey sandwiches. So those are the two bacteria that are known to cause neonatal meningitis. And it's important to understand the difference between them and how they are transmitted. One is transmitted during birth, one is transmitted during incubation in utero. All right, we have a few more minutes. All right, so our next infection is tetanus, and tetanus is kind of an interesting one. Tetanus is caused by a bacteria called Clostridium tetani. So this is another easy one. It's in the name. And tetanus is kind of an interesting one. I know we've talked about it before, but tetanus is a pretty interesting bacteria because it's one of the few that's non-communicable, meaning it is not transferred from person to person, either by direct or indirect means. Okay? You could be having regular sexual contact with somebody who has tetanus, and you will never contract it. Okay, so directly or indirectly, it is not typically passed from person to person. The way tetanus is contracted, the fancy words for it are traumatic implantation of the endospores into the skin. All that means is you get some kind of wound, and the endospores, because Clostridium forms endospores, remember those protective structures, and endospores typically live in the soil or outside environments. And so tetanus is most often contracted when you cut yourself on something that exists outside. So this is why if you have ever cut yourself, poked yourself on a rusty fence outside, or you stepped on a nail, or you hurt yourself on something outside, they recommend that you get a tetanus shot. So if you've ever done that as a kid, you stepped on something or you cut yourself on a fence. I did that once. I was climbing a fence and fell over and scraped like my whole leg, and I had to go get a tetanus shot. Anytime you hurt yourself with something that exists outside or has dirt on it or is rusty, anything that has existed outside, you are at risk for a tetanus infection. Because when you cut yourself with, like, say you stepped on a nail right? You had a nail go straight into your skin. If there are endospores on that nail, you have basically implanted that endospore directly past all of your immune responses. You've gone past the skin, you're going straight into the blood. So those endospores surpass everything and get implanted directly into your body. Okay, so you don't get tetanus by breathing in endospores or coming in casual contact with them. You get tetanus from traumatic implantation of those endospores directly into your body. Okay. Now, tetanus is an infection that infects the nervous system. The key here is when you're talking about your muscles in your nervous system, there are two things that have to happen for your muscles to work. Right? You have to be able to contract your muscles and you have to be able to relax your muscles, right? My muscles don't work if they're all contracted all the time. And they're not going to work if they're relaxed all the time. You have to be able to do both. That's how you move. Even breathing, right? Breathing in, you're moving muscles. When you breathe out, it's relaxing them. It's actually the opposite. But you have to be able to contract and relax your muscles in order for them to work. The way tetanus affects the body is that it causes what's called spastic paralysis, which means that the muscles are permanently contracted. The muscles cannot relax. They cannot do the other half of that equation. So all of the muscles, eventually tetanus will spread to all of the muscles in your body. Tetanus usually starts, one of the things that it's commonly known for causing is lockjaw. So that's one of the first things, is it causes the muscles in your face to be permanently contracted so that you can't open your mouth. It causes lockjaw. Eventually, tetanus will spread to every muscle in your body if it is not treated. And you can have something like this person right here. So this is a person who's in like a full body spastic moment. Their body cannot relax. And these spastic episodes, I guess, the contraction of the muscles is known to be strong enough to break your femur, like break the biggest bones in your body. Your muscles contract so hard and they cannot relax that they literally break the bones inside your body. And eventually, if it's untreated, tetanus causes death because the lungs cannot deflate. So if you can't relax your muscles, your lungs won't work. Because your diaphragm, how you inflate and deflate your lungs, is a muscle. And if your diaphragm can't relax, you will not be able to breathe. So people who die of tetanus typically die of suffocation. Now, tetanus used to be a much bigger problem, but tetanus is treatable now. It can be treated with what's known as an antitoxin, because the problem with tetanus is not necessarily the bacteria itself. Tetanus produces a neurotoxin. So it's basically a poison that poisons your nervous system. So the bacteria itself, the bacteria produces the neurotoxin, but it's not the bacteria itself that's causing the problem, it's the neurotoxin it produces. And there is an immunoglobulin, which is like an antitoxin. Okay, so it basically binds, it's an immunoglobulin or an antibody that binds to all the toxins and neutralizes them, does neutralization. So tetanus can be treated now. It neutralizes the toxin so that you can survive. However, there is a vaccine available. If you've ever heard, it has a lot of different names, Tdap, DTaP, it has a PTaP, I think is another one. It has a lot of different names. I mostly know it as the DTaP vaccine. DTaP covers diphtheria, tetanus, and pertussis. So we're gonna cover the other two later. But the T in DTaP is tetanus. So there is a vaccine available for this. It's one that you're supposed to have updated every 10 or so years. So it's been 10 years since you got a DTaP vaccine. But before, if you ever go into work into any kind of healthcare, they will make you have an updated tetanus shot. But yeah, that's tetanus. So the big thing with tetanus is that it causes spastic paralysis. Because we're gonna talk about botulism next time, but botulism is flaccid paralysis, so they're opposite. Tetanus is constantly contracted, spastic muscles, spastic paralysis. All right, we'll pick up with botulism next time.